Well, as Alzheimer's disease gets older, its patient population grows younger. Many Americans are diagnosed with the disease before their 60th birthday, but only those older than that are eligible for certain services. Washington correspondent Jesse Tenor reports on where bipartisan legislation stands that would allow these younger patients to get the help they need.
Make the journey a little bit easier for them.
Nearly 6 million Americans are living with Alzheimer's. Federal programs connect those patients with health care benefits, job training, even meals. But about 200,000 can't get that help because under current law, they are too young to qualify.
And this population is unique in that the challenges that they face because of their young age, with their families, their careers.
Rachel Conant and her colleagues at the Alzheimer's Association are working on legislation to allow those under 60 to access these home and community-based services at the state and local levels.
There's tremendous momentum to really have Democrats and Republicans coming together in the fight against Alzheimer's disease.
Supporters of the plan think it may help even more Americans because the disease is often misdiagnosed in younger patients.
I think if we study more of the early onsets, it's going to have the double benefit of helping everyone down the road.
Alabama Senator Doug Jones has been one of the bill's biggest supporters, remembering that for many, the disease hits close to home.
My dad suffers from Alzheimer's. He did not get diagnosed until later in life. He's still alive today, but it's a struggle.
Senate and House committees will continue their discussions into the summer, with a decision on the legislation by the end of September. In Washington, I'm Jesse Tenor.
Well, in North Dakota, more than 14,000 people are living with Alzheimer's disease, and more than 30,000 family members and friends are providing that care. Well, stick around. Coming up next on